So now we're on part 3 of the appendicular, upper extremity, in this case, part of the skeleton. And we have the hand that we were looking at both anterior and posterior views. And we just finished up with the anterior view. The posterior view of the carpal bones here is going to be, as you can see, the at the thumb, we always have our trapezium. And then down here with the radius, we always have our scaphoid and lunate. And then coming to the indicus right here, which is finger number 2, as you can see by the Roman numeral, that's going to be the trapezoid. And then this finger right here, number 3, is going to be this middle unit called capitate. Then we have the really big carpal bone, the hamate, and then just below that we have our trichotrum. You can't see it from this side, but piled up on the anterior of the trichotrum is the pisiform. That's right here. Okay, we still have our little disc that can be seen from this side. Then we get to the palmar surface right here, and so the palm of the hand, this aspect of it right here, is going to be the, how shall I say, this is going to be 1, 2, 3, 4, 5th metacarpals. Okay, so what you identify actually as your thumb are just these 2 phalanges right here. Okay, and there's a joint right here at the bottom of your thumb, and then at the base of your metacarpal there's another joint. Okay, this joint down here is special because it allows for a circular sort of cone-shaped motion. So there's this kind of action. Okay, but just the 2 bones right there, that would be the the 2 phalanges, and the metacarpal is associated with the palm. So the palm of the hand then is going to be made up of these bones, and then at the joint, we call this a knuckle. When we close our fingers down, we have this as a knuckle up here, and that's going to be formed between the metacarpal and the phalange. It's called an MP joint, and so the phalanx, I should say, the proximal, middle, and distal phalanx makes up the rest of that indicus. Okay, so that we have 3 phalanges on each of these fingers, 2 through 5, and they're called the proximal, middle, and distal. Here we don't have a middle, we just have a proximal and distal, and that takes care of the hand. Okay, there's some extra little features that we'll see. They're not showing us the little sesamoid bones here, but there are some little detailed extra features that we can toss in at some point. Okay, so then we move on to the more substantial part of the body that's weight-bearing right here. This is our hips, our pelvic girdle right through here. There's some features that are described. In particular, this hip bone, also referred to as an os coxae. You add the E when you're thinking of the plural. Okay, and there's 3 bones that actually fuse together during development that form the single bone at a certain point, which allows weight bearing to occur right here at this surface. Okay. Then you'll see here that we have a brim, a pelvic brim. Okay, we have how the sacrum fits together here at the sacro-iliac joint. This is going to be a movable joint right here. It sort of swivels a bit. This is an immovable joint right there. We do have the obturator foramen, that's formed here when the pubic bone joins up with these other bones over here. Okay, so that's our anterior view, and it's good to learn the nomenclature. Over here on the side, you can see it. You can work your way through it and decide what it all means for you, and make sure that you have it firmly. There's nothing here that's irrelevant in that nomenclature. This promontory is important if you happen to be female and wishing to give natural birth. This is one of the items that gets in the way. Okay, another thing that might get in the way are these little spines right here from the ischium. Okay, another thing, this is definitely a female pelvis based on its drawing, because this is greater than a 90-degree angle, quite a bit greater than a 90-degree angle, and that's another feature, is that the baby's head is going to come through and up and through this angle. Okay. And we're going to compare male and female, and yet one more page away from where we are now. But first, let's learn the bones. They provide us with a little color coding here, where we have red over here, we have purple over here, we have a light beige over here, and we're all coming together here at the acetabulum. Okay, so that's our view. This is a right hip bone. It's the lateral view. It's the view from the side, which means that the femur is coming up and the head of the femur is going in right there, and you can see how it's resting. Okay, this is the anterior view here, which means you could bend forward and you'll still be bearing weight on this part of what's called the labrum of the acetabulum. Or you could stand erect up this way, and the head of the femur will be up against here. Do you see that? So we have options. We can crawl on our hands and knees and use this part of the acetabulum, or we can stand straight up, and then we can bear weight up here at that part of the acetabulum. Okay, so if we were a four-legged animal, we would be actually much more in that position. Okay, then here we have our crest up here. This is where we carry our children or our groceries, right up there on the top of the ilium. It's called the iliac crest. This is a word for wing Allah. It's not a reference to a deity. Okay, here we have a surface where there's going to be a lot of action going on because we have big musculature that's holding us together over that way. Okay, then we have the, this is called the posterior superior iliac spine. Right there, we have our anterior superior iliac spine. This is really important because it's the first thing that we bump with from our iliac crest. It's right here. And it's also the attachment site of a significant muscle. And then we have more of that going on at the anterior inferior iliac spine. Okay, here we have a view from the medial side, which is the inside, so to speak. Okay, and we can see how the this roughened surface right here is where the sacrum is going to fit in. Okay, and again we have these special units right here. Notice that we have this big sort of open space right there. It's called the greater sciatic notch. And here we have a lesser sciatic notch. And it turns out that there's ligaments that enclose these spaces. So when the sacrum is intact right there, there's going to be a ligament that comes down here and encloses that, and then you're going to call it not the greater sacral notch, but the foramen, the greater sacral foramen. And this is going to be the lesser sacral foramen, and the sciatic nerve is going to emerge and come out this way. A lesser nerve right here, called the pudendal nerve, is going to come out this way. And if you're a good OB-GYN doc or midwife, and you've got a syringe with you, you could actually drop some, how shall I say, anesthetic right there. And you could, how shall I say, cause the perineum to become anesthetized and make childbirth a little bit easier for the individual. Okay, so there's all of these special features. Here's the real deal right there. Okay, then we're going to compare male and female in our next episode.